I'm very happy to welcome you here in Sussex. It's great that many of you have been travelling from far and have been willing to come and discuss with us very important subjects and controversial subjects in the life sciences over these 2 days. Today I would like to begin with saying again thank you for coming here, and I hope that you will enjoy your stay here today and tomorrow and longer if possible. And I would also like to point out to you that, and I need to do this, there is no fire exit apart from the entrance. And so if there is any fire by any chance, please go out where you came in. You came here today, well, the weather is not too good. Usually it looks like this. It's a very peaceful campus, as you can see. But it's not always this peaceful. If you go out, if you think you can venture out with some lunch, you have to be careful because it is quite a war zone out there. And so be careful. We've had this before, that people's sandwiches were snatched away from them. And if you do insist that you want to venture out with your food out there, you best bring 2, so at least you can eat. Today, I'll first start to introduce our Bionetworking Panel, which will be chaired by Adrian Ailey from SPRU, the Science Policy Research Unit. He will be keeping the time and introducing everyone later. My name is Margaret Stephen-Faulkner, in case you didn't know yet. Then we will be having a parallel session of 3 panels. Tomorrow we will start with the keynote lectures at 10, and we'll continue in the afternoon with a parallel session and then the science policy panel. First, I will start now with the Bionetworking panel. After a short introduction, we will be discussing some case studies about Thailand and Germany, Switzerland, China and USA, India and Malaysia, India, Japan, and Thailand and Japan. And we will continue with some questions and answers. In our presentations, you will notice perhaps sometimes you hear some names that you're not familiar with and you thought maybe it was someone else that was talked about. That might be correct because we usually use pseudonyms. If you have ever been interviewed by one of us, you know that we anonymize people we interview, so perhaps you will not recognize some people that you normally would recognize. I would also like to point out that most of the things that we're presenting are very new, they're brand new. We've only just come out of the field and present our analyses. This also means that it's unpublished work, so please ask permission if you would like to use some of the case studies or ideas from the authors. That would be great, thank you. Starting with the concept of bionetworking. Well, one could define it, and sometimes it's very difficult, especially when you put lots of very diverse words in a sentence, such as the managerial, cognitive, infrastructural, experimental and exchange activities that support the collective production of knowledge about life, health and medicine. But that sentence isn't very helpful because it's full of different concepts, but the only thing that's, I think, good to remember here is a collective production. It's not scientists sitting in a room thinking of new ideas, but it's a society that produces scientists, and the scientists that work in infrastructures in the society that together produce the science. Bionetworking especially looks at the transnational, the international processes that are relevant and important to the production of science. So we look at the long-term developments of what is called also by Shido Jezanov, the co-production of science and societies, where cross-boundary and especially transnational life science activities are crucial. And well, when we talk about society, well, when Sheila Jesinoff talks about society, it's usually a nation state. But what we do is we look at different regional boundaries, and also we sometimes make up the boundaries because we suddenly find that there are boundaries between groups of people as well as between nation states. So it's not just a territorial matter with regulations that might be governed in each country, but it's also between different cultures, between different scientific cultures even, that we find differences that are very relevant to the production of innovative science products. Bionetworking also looks at the way that knowledge is produced and justified and legitimized. This is particularly important because no matter how important your knowledge is, without proper credibility, without acknowledgement of your knowledge, then you cannot communicate this. And I think some people in this room will really sympathize with that, because they feel, well, my voice hasn't been heard, and so people don't understand what I'm doing, and therefore they believe what I'm doing is not science. Whereas other people might think, well, maybe it is not science for other reasons. So there are various opinions actually, because of the importance of the need for scientists to have to legitimize their knowledge. Bionetworking also looks at how science or health is being embodied and how it is associated with moral good. So cleanliness is good, is hygienic. Science supports it. So in short, and I don't want to introduce lots of jargon into this discussion because I know that we all have a different disciplinary background. We look at collective processes of producing science, socio-political factors, we look at the morale and the discursive factors, we look at transnational processes, we look at how knowledge is being legitimized, and how this is all embedded in a material and institutional world. Well, having said these very general things about bionetworking, I want to say a few things about the projects that we have been studying. We have 3 projects. One is about stem cell banking, and to understand the banking of stem cells, we've been following intellectual and material resources between countries. So we look at how, for instance, cells travel from the human into a bank, how they're being sold into another bank or a clinic, and how these travel. A second project is about stem cell therapies, and we've been looking at the networks between patients, providers, hospitals, and the processing of stem cells. So various of our teams have been spending quite a bit of time exploring these processes, especially in Asia. What we've also done is organized roundtable discussions, workshops, and conducted research among patients and asked them what their needs are in relation to stem cell research and other solutions possibly for their diseases. We've created some policy briefings about this, and if you go to the gallery room on your way there, you find a table where you could pick up some of these briefings and have a look at them, because they're important, I think, for the patients for whom this is all meant to be. 2 themes are central into our work, and they're themes that actually exemplify a tension between collaboration and competition. Well, as I just mentioned, science is a collective enterprise, but nowadays you always hear about scientific collaboration, and then you wonder how that works, because the science world is also a very competitive world. So how does this work in scientists within a network? Are they working together, or are they working against one another at the same time? So this is one of the themes that we've been looking at. We also have been looking at the difference between what is also sometimes thought or called bona fide and rogue stem cell therapies. And I will talk about this in a minute, but what the main thing is that we try to do is to see how the meanings of these concepts are both contextual, so depending on where you find the stem cell research, and performative. And I'll say more about this in a minute. So in practice, what we try to do is we follow and we map the circulation of biomaterials, life science knowledge and life science assets. And we study long-term developments of the co-production of regenerative medicine across cultural, national and other boundaries. And we try to explain those trends and circulations through the logic of the technology, its material and regulatory embedding in relation to the world of culture and political decision making. You often hear that science doesn't have any boundaries. This is maybe something very obvious to say, and in many countries, I know that in China it took a long time before it was recognized that there are no forbidden zones in science. But on the other hand, if we look at the development of science in reality, we do notice that there are quite a few boundaries that are to be, quite a few hurdles that have to be taken in order to do some kind of scientific research. Some scientists feel that there are high boundaries for them to do their research. But in general, what I would like to argue here now is that when we try to describe good science and bad science in terms of bona fide and rogue science, and here I'm talking about the case of stem cell research, I think we only find a very few examples that fit into these two categories. The most interesting field, in fact, is a large, very large grey area in between. So the binary between snake oil and bona fide highest class science is nearly an artificial one, I would say. This binary has been advertised in the press. It portrays well-funded, cautious research laboratories versus commercial venturers reacting to patient demands. And of course, among scientists, of course, it's also being used. If you want to describe your own research, you're not going to describe it as rogue. No, you would say it's very good, bona fide research. It's also a way of pulling up a boundary, making a difference between the science that you think is good and the science you think is not so good. But what we are interested in this group is the large grey area where you see those question marks between the rogue life science and the kosher life science. And if you look at the reality of life science practices, especially in stem cell research, as we have done, you'll see that the regulation of the science is quite different in different countries. So if you look at one country, you'll find that there are very different criteria for good and bad science, and you compare it to another country. And the same is true for ethical oversight and business practices. Often it's been said that rogue scientists, they only want to make money, and good scientists don't. But then, especially here in Europe, we forget that we get funded by the state to do our science to a large extent, and in other countries that's not always the case. So how do you keep the enterprise going? So we've been trying to look at all these different factors that make up what people call good and bad scientists. So the very large grey area that we like to talk about is actually a very complex reality. There's unclear relations between the private and public players often, and they have mixed interests, and all of these are involved in producing science. As for clinical trials, it's not always clear what is being tested in clinical trials, whether it's scientific knowledge, the patient, or the product. We also find that in various countries, the funding, the level of funding is not the same. So in these countries you will find that there are limited means for conducting clinical trials, and this differs per area. And in some countries there are so many patients because they do not have enough access to healthcare, and there is more a demand for new cell therapies and research. So, well, how did this very large area, a grey area, come about is the question now. And if you want a short answer, and I'll try to explain this in a minute, the short answer would be, well, there's an increasingly high and interlinked standards used in biomedicine and related fields, and there is unclear variations between the countries. So this makes for an enormous variation of the boundaries between which scientists have to work in practice. You see more and more collaborations also between state, industry and scientific institutions. So this means that there's a very complex regulatory requirements and interdependence between various institutions all engaged in the science. So it's very difficult to see to what extent there is some good science or bad science being created. And well, together with rapid commercialization and globalization, the contrast between elite science and quackery is fading. Due to the multiple forms and the variable interpretation of science and also the implementation of regulation, you'll find that the practices of science are very difficult to compare. We'll give you examples of these relatively abstract pronouncements, but I will say before that just a few things about how one can find an enormous variation in the global trends of science development. So one global trend is the collective and interlinked nature of biomedicine that Keating and Cambrosio have been writing about. Formerly, if you were ill, you'd go to your GP and you would get a clinical diagnosis. And there and then you had an expert that would look at you, and it would not involve, as it would nowadays, a test that has to go to the laboratory, be analyzed. Screening and diagnostic methods have changed quite a lot. Nowadays there's a need for multi-center clinical trials with sophisticated laboratories. You need sophisticated instruments and devices that produce results that you can compare over time and between patients. So it takes a lot of time and investment to create such laboratories and such healthcare provisions. So in some circumstances, in some countries, this is not affordable. In another trend, a global trend, is an increasing dependency on regulation in science. There is more and more agreement about standards needed for the systematic and collective production of evidence. There are also trends going in the direction of the use of conventions rather than what are called truth criteria to show that science is correct or not. One instance is the discussions nowadays around what's called pluripotency. Rather than first getting scientific evidence for the pluripotent nature of cells, it is more important to make the science communicable between the scientists. So agreements have to be made by international committees to find a commensurable way of talking together about what pluripotency is. So standards are not only define scientific judgment, but nowadays also more and more are clinical indications. So, for instance, if you think about trisomy 21, like a chromosomal abnormality, these become more and more the same, and the same for PSA tests. Apart from a scientific measure, it's become a diagnostic method. And so more and more you get a favouring of conventions that enable the collective production of evidence. But at the same time there's a considerable capacity and funding needed to adopt such regulation. And that's not possible everywhere. So there's enormous variations between countries about the extent that this is actually being realized. A third trend is a global focus on what one could call elite science. So if you look at the standards that are becoming more and more important with these conventions, who is formulating these standards? And how are they being introduced? It's happened through highly regarded peer-reviewed journals, through regulations vetted by modern bureaucracy, and this novelty is also being defined through intellectual property rights. So, and if you look at where the political discourses about the norms and the values that define the ethics that becomes a part of the regulation is happening, then you will see that it's usually in societies of high wealth and developed healthcare systems. So it's not as easy for people in every country to stick to these highest standards and conventions. And the fourth trend is that of the globalization of regulation and standards as a condition for collaboration. If you want to collaborate with the scientists on the other side of the world, you need to become aware of the regulation in this country, especially if you want to publish together. So there's altogether a spreading awareness about the regulation in many different countries. At the same time, though, there are nowadays MAs in international entrepreneurship, where you can learn how to juggle the different values and different regulations and the availability of patients to fit your scientific project to. Another trend is increased reliance on entrepreneurial networks. And nowadays, the PIs of science projects that I've met, they actually were spending a lot of their time doing management and administration. And often, of course, that's a complaint, especially because if they have to do courses in management and do the negotiations for the lab, and their job is actually something that they hadn't planned when they were younger. They have to be savvy about regulations, about IPR, markets and resource management. What they have to do then is interpret and translate local guidelines, and they have to do situational decision making and transnational decision making. So there is a kind of entrepreneurial management creeping into the science in that sense. And there's also an increasing reliance on high tech, as I just mentioned, in biomedicine and healthcare. It costs an enormous amount to invest, not just in GPs, but also the laboratories that they need, the training of lab assistants, the expensive equipment and collective insurance. And these are not everywhere the same. And therefore, in countries without these equipments, the patients will have different options, healthcare options, than in others. And all these global trends and varieties within these global trends make for a very colourful practice, also in stem cell science and stem cell therapy provision. And which is why this grey area is so very important to research. So these mixed practices, they result from a variability in the use and interpretation of standards, in the quality of international collaboration, in the variability of patient demand and healthcare access, the variability of regulations, various levels of investment and knowledge assets, and various social-political cultures. So in our research, the way forward to us would be to uncover cultural and political prejudice and analyze entrepreneurial and organizational strategies within the science. As such, we want to understand the social and material factors behind the formation of such grey area. And in the end, we would hope to be able to look for institutional mechanisms that will make it possible for scientists to cater to patient needs when it is actually relevant. And we also would like to discuss the prejudices about the presumptions regarding the kosher, the bona fide, and rogue binary, and the competition and collaboration binaries that make up this large grey area. And we also, in the end, would like to contribute to proposals on regulatory changes, such as that of the ISSCR, which is the International Society for Stem Cell Research. But ISSCR is a part of the problem for many scientists, so we hope to discuss this also more detail. Here's a picture of the whole team, and thank you for listening. And we will now start the individual presentations and case studies of the members of the team. Thank you.
Thank you, Margaret. So, as Margaret said, I'll be chairing this panel session, and it's my pleasure to invite each of my colleagues up to outline some of the work that they've done, excuse me, employing this concept of bionetworking in concrete national and transnational situations. First, I'd like to call on Nataka Chaisimtop, who's going to be talking about some of her work in Thailand and in Europe.
Good afternoon, everyone. So today I'm going to talk about fresh cell tourism from Asia to Europe, or more specifically for this presentation, from Thailand to Germany. So first of all, what's fresh cell therapy? It's also known as cell therapy or live cell therapy, or a few other names. And basically it's a procedure that involves injecting cells or cell components of animals into humans. So in the case that we're looking at sheep cells, and it's supposed to be based on the principle of like heals like. So you would inject liver cells to treat liver conditions. Practitioners of fresh cell therapy often talk about their long history and tradition, and some would refer as far back to the 16th century to Paracelsus' concept of like heals like. But most would refer to Paul Nihans, a Swiss doctor, as the father of cell therapy. Nihans discovered the method in 1931 and went on to popularize it in the 1930s and 40s. And he reportedly treats some famous people, as you can see from the pictures. But over the years, fresh cell therapy has actually become quite a marginal practice in Europe, in that not many people actually know about it, and not many people would actually seek out this particular treatment. It's also controversial in that it has not been proven in clinical trials that it's safe and effective. And it's actually banned in most countries in the world, apart from a few European countries, such as in Germany and Switzerland. In 1997, the German Ministry of Public Health did try to ban it, but they were not successful because it was seen to be impinging on the rights of medical practitioners to carry out this type of therapies in their own clinic. And at the moment, so it's regulated as an individual medical practice. Over the last few years, actually, there's been a real revival of interest in fresh cell therapy in Asia, especially in Thailand and the Philippines. In 2009, a businessman from Thailand bought the fresh cell clinic in Germany. And before his acquisition, the clinic reportedly served only a small number of clients, about 50 clients per year. But now the clinic claims to serve well over 1,000 clients per year, most of whom travel from Asia to the clinic in Germany. And quite a number of clinics in Thailand offer this fresh cell tourism package, where they take clients to Germany, and typically they spend about 4 days at the clinic. And the package includes medical consultations before, during and after the trip, supplementary therapies such as oxygen therapy and vitamin drips, the actual fresh cell injections, full board accommodation, transportation to and from the airport. And the cost is, as you can see, is not cheap at all. It's 15,000 euros excluding airfare. fresh cell therapy is actually becoming quite popular amongst the rich and famous in Thailand, and as you can see, they're going groups to visit the clinic. And these are the vitamin drips and oxygen therapy, and she's actually quite a famous singer in Thailand. One thing that the new owner did to kind of transform this fading practice into this new exciting therapies to cater for the needs of the wealthy and mobile individuals. So as the owner said himself, that he hasn't actually made any changes to the method of fresh cell therapy, but he has invested 4.6 million euros to renovate the building, the guest rooms, make the whole thing more luxurious. And he also employed a very well-known discourse of Thai hospitality to make sure that the clients are well taken care of during their stay at the clinic. And as you can see, the clinic is very modern, very luxurious, and to ensure that clients can have a comfortable stay. Another thing that he did was to cultivate the networks of patients. In general, medical tourism, as research has shown, the personal recommendations and word of mouth is also very important in medical tourism in general, but I would argue that in this case it's probably more important because the clinic can't rely on official channels of information to promote and recommend a practice. So for example, a doctor or a GP can't really recommend a patient to go and have this fresh cell therapy. And actually in Thailand, the Thai Medical Council strongly discourages people from traveling to seek the treatment. So they've kind of found the alternative source of authority to promote the practice as a trusted therapy through personal recommendations and so they've really tried to organize these events such as the afternoon tea talk where old and new clients can meet and exchange information, talking, the kind of first-hand experience, so they can talk directly with the people who've actually received the therapy themselves. And it's quite interesting. So for example, this person that I spoke to who received fresh cell therapy, he said that he became interested in fresh cell therapy after seeing that his friend's skin has improved so much. And I think it's very interesting the way he said that you can't just try any old therapy. You need to see the evidence before you decide to have a therapy. But for him, the evidence is not the clinical or scientific evidence, but it's something that he can see with his own eyes. So it's I think it's very interesting the way that patients might have different concepts of evidence to scientists and researchers. And another way that the clinic has tried to create interest in fresh cell therapy is to link it to stem cell therapies, which in Thailand as elsewhere in the world is becoming a really exciting field of research and attracted a lot of interest and hype and attention. So for example, this is taken from a website of the clinic that does fresh cell therapy, and they put up images about stem cell therapies and also news items on the latest development in stem cell research. So they're clearly kind of linking fresh cell therapy to the field of stem cell research. And more than that, the Association of Cell Therapy Thailand, which was set up to promote fresh cell therapy, they also organize an annual conference, the International Cell Therapy Forum, and they've invited both scientists working in the field of regenerative medicine and commercial practitioners of fresh cell therapy. And I have to say that although the scientists don't actually agree with fresh cell therapy, by having them kind of appearing in this public event together, I think it kind of gives the impression that fresh cell therapy is part of regenerative medicine research. And they've also been quite good at forming connections with important people from the government. So for example, He was a minister from the Ministry of Science and Technology, and he opened the proceedings for the conference, so it gives the fresh cell therapy the kind of prestige and certain credibility. And there's a real confusion in Thailand, whether fresh cell therapy is a stem cell therapy, and I found that people kind of tend to use the terms interchangeably. So, for example, this celebrity, she said that she'd just been to Germany to have stem cell injections, but what she actually had was fresh cell therapy at the German clinic. And this really popular talk show, they did an episode called Stem Cells, but most of the program was actually devoted to fresh cell therapy in Germany, even though the episode is titled Stem Cells. And another way that they've create interest in fresh cell therapy is to present it not only as a therapeutic treatment, but link it to rejuvenation and beauty treatment. So, one of the ways to achieve this kind of radiant, youthful, white complexion. And as you probably know, that skin whitening is a huge industry in Asia. So, by presenting fresh cell therapy as a beauty technique, it also created a lot of interest in the practice. So to conclude, how did the new owner manage to transform a fading practice into a thriving global business? Making use of the regulatory gap, in this case in Europe, capturing and catering for the market of wealthy and mobile individuals, understanding desires, anxieties around health, longevity, bodies and appearance in Asia, appealing to the practice's tradition and long history while simultaneously linking it to the new exciting field of stem cell research, cultivating connections with important people from the government, and finding alternative ways to legitimize the practice, not necessarily through clinical trials, but through personal recommendations by influential individuals. Okay, thank you.
Thank you, Nataka. I expect that some people may have questions for Nataka and for other colleagues, but what we're going to plan to do is just to hear briefly from each of them, and at the end we will have everyone on the panel here, and so save up your questions until after the last of our presenters. Next, I'd like to call on my colleague Achim Roseman, who's going to be talking to us about some of his work, which has been looking at China and the USA.
Yes, welcome everybody. So the title of my presentation is Randomized Controlled Trials in Stem Cell Medicine, Emerging International Networks of Conformity and Resistance. Well, as you're well aware of, the use of randomized controlled clinical trials has nowadays become a global gold standard in medicine research, and the conduct of phase 1 to 3 trials are now a mandatory requirement in order to test for the safety and the efficacy of new medical treatments, and they are demanded by most drug regulatory authorities before a new medicine is introduced to patients. Now, interestingly, in the stem cell field, we see that the international landscape of regenerative stem cell medicine, we see that the use of randomized controlled trials is widely contested. There have been calls for alternative, for less costly, but also less systematic forms of clinical research. What can be observed overall are two divergent trends. The one is the emergence of global networks or infrastructures that adopt, that implement and promote randomized controlled trials in new geographic as well as institutional context. And the other trend is the emerging of international organizations and networks in which the use of clinical trials is opposed and in which alternative clinical research methods are promoted. Now, I want to explore this through two divergent case studies. The first is the China Spinal Cord Injury Network, which represents the adoption of randomized controlled trial methodology, and the other is the International Cellular Medicine Society, in which kind of randomized controlled trials are widely contested and an alternative system of research standardization is emerging. Let's start with the first case study. So the China Spinal Cord Injury Network is really the first intercontinental clinical trial infrastructure that is, in the stem cell field at least, that is active across the context of the United States and China, and it includes also hospitals in Hong Kong and in Taiwan. Altogether there are 25 hospitals involved, and there is a smaller network in the United States. This network is dedicated to the testing of stem cell-based approaches to cure spinal cord injury and also other neuroregenerative disease through the use of highly systematized trials. Now, based on my empirical study of this China Spinal Cord Injury Network, I would first of all like to present a number of findings with regard to the challenges for the conduct of international randomized controlled trials. And the first point is really that this very high level of regulatory differences in the stem cell field across countries presents very huge challenges for the organization of international trials. There are problems especially with regard to the kind of to the approval, regulatory approval, especially in the context of China, where the regulatory kind of situation is still emerging and the unified approach has not yet been implemented. Now, a result of these regulatory differences is the need for extensive forms of scientific self-governance, capacity building, and the reorganization of local clinical environments, so as to enable the standardized implementation of research protocols and also to compensate for regulatory gaps as well as differences in clinical practice between different institutions. But the adoption of international randomized controlled trial methodology in the stem cell field, and this applies to most countries in Asia, with the exception of South Korea, Japan, and Taiwan, is really highly situation specific. It is bound to very select and usually prestigious, well-funded clinical projects or who have invented very creative forms of mobilizing funds. And it is not a widely established standard. Now, as a result of this, the conduct of clinical trials does usually coexist with other less systematic forms of experimental clinical research within the same hospital, within the same department, and sometimes under the supervision of the same principal investigator. Now, another important insight from the China Spinal Cord Injury Network was that the implementation of standardized research protocols is really only the tip of an iceberg of a much larger project of relationship building. As these photos show, in order to provide support and legitimacy to this network, the organizers of this large-scale network had to engage with officials and with political stakeholders in both mainland China and the United States. And we see here a photo from a dinner in New Jersey with the governor of New Jersey, with officials from the Ministry of Health, as well as with representatives of the China Food and Drug Administration after its reorganization, I think, in 2007. Well, another crucial aspect of relationship building that underlies the formation of this China Spinal Cord Injury Network is, of course, the mobilization of financial support. And in Hong Kong, where most of the funds for the China Spinal Cord Injury Network were raised, we see the creation of a charitable organization, and this organization has really evolved, organized dozens of events, of TV shows, of gala dinners, and also international events. Here a collaboration with the Rikansen organization, which is one of the largest spinal cord injury research organizations in the world, in Hong Kong's Zhaxim Racecourse, which is a very huge event. So the China Spinal Cord Injury Network was extremely creative in organizing funds outside of the established state structures. But this is only actually the fraction of a very large project of relationship buildings, and I don't have the space to go into the details. But I would like to continue with the second case study, the International Cellular Medicine Society, which represents very much the opposition toward the adoption of randomized controlled clinical trial methodology. The International Cellular Medicine Society, I will call it now ICMS, is not a clinical research network as the China Spinal Cord Injury Network, but it is a professional society that is dedicated to the promotion of physician-based forms of clinical experimentation, especially of autologous cell and stem cell-based treatments. This organization was founded by a physician and clinical entrepreneur in the United States, and it has members from allegedly 35 countries with international chapters in China and various countries in South and Middle America. Now, the ICMS, as I've mentioned, opposes the role of randomized controlled trials as a mandatory requirement, and it promotes the use of more individualized forms of experimental clinical practice, often on a for-profit basis. The central argument here is that the use of that randomized controlled trials functions as mechanisms of exclusion. They require huge amounts of funding, organizational resources, as well as infrastructural resources, and they preclude physician-based forms of experimental application. As a result, the ICMS has developed an activist agenda, and it has created an alternative system of research standardization. And this is what I will now in the last slide refer to. So this system has evolved along 4 central parameters. The first is the development of professional guidelines, and these guidelines have been designed to review and to legitimize physician-based forms of clinical translation, and they shall form as an alternative to the much more stringent review criteria for autologous cell therapies in the United States by the US FDA or other drug regulatory authorities elsewhere. Now, the second mechanism that has been introduced is the provision of an institutional review board service. And this IRB is formed by members of the organization, and it offers its services to interested stem cell clinics. A third point is the introduction of an open treatment registry. This registry is a database that stores self-reports of patients which have been generated based on standardized evaluation criteria in a form of self-comparison, and these are gathered from various different clinics with regard to the treatment outcomes and also potential complications of experimental stem cell treatments or other cell treatments. The fourth point is the provision of a stem cell clinic accreditation program. And with this program, the ICMS offers an accreditation service for stem cell clinics who are interested in a form of legitimization outside of established institutional regulatory structures. Now, in essence, we could say that these 4 mechanisms try to increase the legitimacy of for-profit experimental stem cell treatments, because many of the participants also of these organizations are actually involved in the for-profit application. So this is of course a very interesting element, and in order to kind of endorse, promote these treatments outside of the review of national level drug regulatory agencies and independent of the use of randomized controlled clinical trials. But we will hear more about these forms of alter standardization and resistance in panel 1 in approximately 1.5 hours from now on. Thank you very much.
Achim, thank you very much. And again, if you have questions for Achim, please save them up and remember them just for a few minutes' time. So next I'm going to call on Carrie Heitmeyer, who's been doing research in India and in Malaysia, and she's going to be talking about that research now.
Thanks, Adrian. So I'll be talking today about building a knowledge economy through bionetworking, and specifically looking at the role of Indian scientists, entrepreneurs in Malaysia. To give you a bit of context, there's meant to be a picture there. I'm not sure why it hasn't come out. But Malaysia is a relatively late comer in terms of the wider Asian biotech boom. It's only been in the past about 5 years that it significantly started to invest in biotech as both through both the economic transformation program and within the national biotechnology policy. So investing in stem cell research both in terms of the economic building up the economy, but also as a wider political project and sort of nationalist project as well. And specifically, it is looking to build the national biotech sector, including regenerative medicine, as a means of converting the country into, quote, from a, quote, developing country into a, quote, developed country by 2020. Oh, there we go. Okay. So according to a recent report produced last year by the Academy of Science Malaysia, quote, the gulf between developing and developed nations is wide, and this can be bridged only through having a consistent policy of investment in both our infrastructure and human capital. Life sciences and biotechnology are one of the cutting-edge areas in which we should be focusing our attention. In this area, cell therapy is projected to become the key research field in the next 5 years. So as we can see from this quote, stem cell science and the building up the stem cell sector is seen both for its economic potential as well as more generally bringing Malaysia into sort of the status of development research or development progress and modernity. So this is a slide taken from the a PowerPoint presentation by the Malaysian Biotech Corporation, which was one of the key agencies in building up the national biotech sector. And as you can see, cell therapy is one of the key areas of investment and growth. So it's right here on the bottom. One of the main problems that it's encountered, however, as you can see from the little picture here, which is taken from a government report, is the lack of researchers and people with the scientific expertise as well as the entrepreneurial skills and knowledge to be able to build the stem cell sector in Malaysia. So as it says here, Malaysia's number of researchers for 1 million population, only 365. So this is seen as it's one of the biggest challenges for the building a knowledge economy in the country, given both the low level of in-country expertise in regenerative medicine, as well as the lack of entrepreneurial knowledge in terms of the means through which to commercialize scientific knowledge into, for example, large-scale stem cell products, umbilical cord banking, and commercial stem cell therapy. In contrast, India, according to a report by Salter, Joe, and Datta, is second to China in terms of the number of commercial stem cell providers operating within the country, as well as the number of patients treated. So, in that sense, India has quite a significant resource in terms of this more technopreneurial expertise when it comes to the field of stem cell research. And part of the wider idea is to bring Indian companies, as well as there also has been Chinese companies as well, into Malaysia to then be able to impart the knowledge in these fields to local scientists who can then start spin-off companies and build a national biotech sector. So as I mentioned in the last slide, the Malaysian Biotech Corporation is the primary agency responsible for recruiting foreign companies into Malaysia. And a key part of the way that they bring companies in to start up clinics or laboratories in Malaysia is through what's called Bionexus status, So once a company applies for Bionexus status, and is then, once it is granted, it receives significant incentives, including tax incentives, access to infrastructure. It can bring in its own scientists and workers into the country with very few barriers, and financial incentives as well. So in the research that I've been doing, I've been specifically looking at two companies which are the primary actors who have been operating in Malaysia. So Stempeutics, which is one of the largest companies in India, conducting clinical trials using in regenerative medicine, and it's part of the larger Indian Manipal group. And Manipal has a much longer history within Malaysia. It has a medical college in Melaka, south of Kuala Lumpur, and established networks that have been there for several decades. And the second one is NICEL. So NICEL is the name for Nichi in Center of Regenerative Medicine, which is a Chennai, South Indian based stem cell clinic, which uses Japanese technology in order to, and provides, in addition to conducting stem cell research, it also provides commercial stem cell therapy. So what are the tensions that have come about through this process of bringing in foreign expertise, and specifically Indian companies, into Malaysia as a means of boosting the national creating the national knowledge economy and biotech sector? Well, in particular, tension has taken place. In the beginning, it was very much, the focus was very much into bringing companies in and getting them to establish laboratories and clinics within the country. But as time went by and more companies were expressed interest and approached the Malaysian Biotech Corporation, as well as other arms of the Malaysian government, about setting up shop in Malaysia, particular concerns around ethics and scientific rigor became more evident and more of an issue on the table. So this is a quote from Adila, a fictional name, who works at the Malaysian Biotech Corporation. And she says, when approached by companies interested in conducting stem cell therapy in Malaysia, we go and say, no, you can't commercialize these products. You can't start producing. They'll say, I'll get my GMP, and then once I have my GMP, I want to use it as therapy and not as research-based. I'm not going to do clinical trials because they've already been done in China 8 years ago already. And we say, I don't care, this is Malaysia. If you already have done the clinical trials somewhere else, then show us the safety and efficacy data. So I think this quote really brings out the tensions and some of the issues that have come out in terms of, on one hand, wanting to recruit or bring in experts instigate sort of stem cell sector and stem cell regenerative medicine as a business, as a sort of economic sector, and then also